Professor Dominic Dwyer is an inspector for the WHO as part of the team. He joins us now from Sydney. Dominic Dwyer, welcome. So how convinced are you that this virus did in fact originate in a bat and somehow pass to humans through an intermediate animal in some kind of natural way?
Well, look, that's always been the pattern of spread of these viruses, from bats into some sort of animal into humans. It happened with SARS, it's happened with MERS. So therefore, that's the most likely. We also know that animals that are sort of permissive, if you like, to SARS-CoV-2 have been present in markets in China and elsewhere. So all of those sorts of things point to that being the most likely one. Not to say that the other things aren't excluded.
Yeah. So what is the possibility, though, still, after your investigation, that this virus leaked from the Wuhan lab?
Well, look, we felt that that was the least likely or most unlikely scenario. It's still possible. It's still on the table. It really depends on what sort of evidence we have to take that further. So we haven't dismissed it. It's really just a matter of getting the evidence to show that such a leak might happen. These things, fortunately, are pretty rare.
Yeah, so what makes that the least likely? Is it just the fact that you haven't got access to enough information, or did you get access to all the information you wanted?
Well, look, we certainly got access to the laboratory. We visited the laboratory. We talked to the scientists doing the bat research. We talked to the safety people. We understood what they were doing for their staff health and so on. So in terms of that information, we were happy that this wasn't a much less likely scenario. Now, of course, we weren't charged with doing a forensic examination of the laboratory. That's another whole different process altogether. But certainly on what we saw, I think we were pretty happy that it was pretty unlikely that it would be a laboratory leak.
Yeah, so compared to other investigations that have been done into virus origins, do you feel that this investigation was hindered or compromised at all?
Look, I actually think we got very good cooperation from our Chinese colleagues. Yes, you could argue it was late in the piece to do this sort of investigation. Yes, there are more things perhaps that we might have been given. But in general terms, they gave us a lot of data that the world hasn't seen before, and we were able to analyse that. Look, there are other things that are still ongoing, things that we've suggested to them that they do, and they're doing those now. So I'm fairly open that we got a pretty good run.
Yeah, and so taking that into account, is there very little likelihood at all that that it did leak from the Wuhan lab?
Well, look, I think it's a low possibility. I mean, laboratory leaks are rare. They're generally in the context of when people are growing up large amounts of the virus in the lab, which is not what that lab was doing, at least with closely related coronaviruses. So, I think that we certainly considered it, and so did the Chinese, but the evidence didn't point to that. But we've left it on the table, and if more evidence comes forward, fine, it needs to be followed up. I think the other scenarios, though, were felt to be more likely, given our history with these sorts of viruses.
And what more work needs to be done? Is China cooperating with that?
Oh, very much so. So we had one part of the work was just reviewing what they'd done to date. We've done that part, and that's what's in the report. The second part is, what do we do to go further to develop these ideas, to do further work, extend the scope of the studies? And those sort of phase 2 things are actually underway. Some of it's actually already being done. Others will actually take some years to do. So I think, I think we're heading in the right direction. Sure, you can argue the toss over some of it, but in general, we're heading in the right way.
Can you give us a layman's description of what some of that further work is?
Well, part of it is about looking at what sort of animals were sold in the marketplaces in Wuhan, the Wuhan market in particular. Where did they come from? What sort of people were bringing those products to market? What is their health like? Do they have interactions, for example, with bats and so on? So that's one part. The other thing is also doing studies around, could this virus be transmitted by other mechanisms, such as with cold food products and so on? That's another sort of possibility. There's also looking at the genetic data of the viruses. We did a lot of that work while we were there. extending that further is also important. So there's a whole range of things that are outlined in the report. And as I said, a number of them are already underway.
Has it gone back to business as usual at these markets? Because you visited the Wuhan market yourself. And if it's back to business as usual, are you concerned about the ongoing likelihood of this happening again?
Well, certainly the Wuhan market, where the sort of outbreak exploded, if you like, in Wuhan, that is closed. However, when you visit it, it's pretty easy to see how such an outbreak could occur just by the very nature of it. Now, China and other countries have made wildlife trade illegal. Whether, of course, it happens, even though it's illegal, is a different question. But I think those sort of markets and that sort of interaction between animals, particularly sort of more wild, non-domesticated animals, is a big problem. And this whole One Health approach to understanding animal health and human health is really key to understanding future pandemics.
Yeah. And so there's still a lot of work to be done to regulate what happens with wildlife?
Oh, well, look, I think so. I mean, I don't understand the regulations, of course, in China, but I think how the world in general manages its wildlife, not just from the point of view of saving our wildlife, of course, I think that's really important, but particularly our interactions with wildlife and particularly around the production of food. And I think these are, complex and long-standing arguments that need to be sorted through by, people expert in the area.
Now, what is the possibility, you think, that the virus, this COVID-19 virus, actually originated in a country other than China?
Well, look, this has had a lot of discussion. Clearly, the virus blew up in China. There's no doubt about that. And clearly, the epicenter in the beginning was Wuhan. What we don't know is what was happening really in the month or two before it got going in Wuhan. Was it spreading quietly in Wuhan that nobody knew? Had it been spreading somewhere quietly elsewhere and was brought into Wuhan? Who knows? I mean, we know in Australia that our first case, for example, in New South Wales was on the 24th of January. And prior to that, we had 3 flights a week from Wuhan into Sydney. So, there is the risk that we might have had cases in Australia even earlier than then. And I think any country that's had big outbreaks needs to really be looking at what sort of things might have occurred before they first had cases.
And is some research now being done on bats in caves in that Southeast Asian region in this hunt for what the origin of the virus? Are there researchers going into caves and catching bats and testing them to see if they do have this virus?
Oh, there are indeed, and certainly the Chinese themselves have done some studies in bat caves in Yunnan province in the southern part of China, because they had people who'd gone into those caves who had got sick with some sort of illness. And indeed, coronaviruses have been found in those caves. They're still distant enough from the SARS-CoV-2 virus not to be the parent virus, but somewhere out there, in my opinion, is a bat with SARS-CoV-2. We've just got to find it. Whether it's in southern China or in the countries bordering China that have similar bats, Vietnam, Cambodia, Laos, Hong Kong, Japan, they've all had bat viruses. So I think it is a bit of a global look for these viruses, but obviously a focus in southern China and the region.
And why is there the theory that there had to be an intermediary animal? As you say, there are cases where where people have fallen sick after actually going into caves with bats. Is it possible that a human actually caught it directly from a bat?
It's possible. I mean, generally the interaction between humans and bats is uncommon.
Right.
Definitely, because they carry a range of diseases, even in Australia. So fortunately, that's common. Generally, what seems to happen is the bat gets into some sort of wild animal, which then has contact with humans. So these animals might be animals that are brought to market, for all we know, or slaughtered for food or what have you, or even fur, like mink and things like that. So I think that the usual scenario is that it goes from a bat into another animal, which has closer contact with humans than the bats do. But it's certainly possible it could go direct from bats. So don't eat bats.
And Professor Dwight, do you have an ongoing role in the investigation into this now, or have you basically wrapped up?
No, I think the sort of second phase of studies will involve a whole range of people, including members of the current team, but also people that have specific expertise in those areas. I mean, I think there's a whole program of work that needs to be done in a whole lot of places, and it's going to need lots of different people to do the work, to fund the work and so on. But the WHO team will certainly be involved in these phase 2 studies.
And Dominic Dwyer, you're back in Australia now. Just keen to get your assessment of where we are in Australia at the moment. There's a fair bit of discussion today about where Australia is with the vaccination program, because the hope was to have had 4 million Australians vaccinated by now. It's at around 500,000, I think, have received at least their first dose. How do you feel about the way that's been managed?
Oh, well, look, I think the vaccine rollout is obviously crucial to handling the pandemic. We have been both very lucky and very good at managing COVID-19 in Australia in terms of how many cases we've had and how they're followed up and managed and so on. The next part of this is about vaccination. We need to do it as quickly as possible, given the constraints of access to the material and the actual rollout of this sort of very difficult logistic exercise. So, look, I think we're on the way. Yes, you might be able to criticise it, but I think in general terms, we're certainly heading in the right direction.
Yeah. And what about the apparent incidences of transmission from overseas travellers to public health workers? It sounds like that's happening. 2 cases in Queensland. What do you think about the standards of that at the moment?
Well, look, obviously the main way this virus is going to get into Australia is through people coming back into the country through quarantine. And then if they are detected as being positive for COVID-19, of course, then they've got to be looked after either at home or in the hospital environment. So the infection control aspects of how you manage both the quarantine hotels and people who might be in hospital, or indeed people in the community, is super important. These viruses are very transmissible, as we know, so the quality of our infection control procedures has always got to be good, and we've got to make sure that there aren't slip-ups, and if they are, jump on them quickly. So I think this will be the pattern of things to come for a while yet, until everybody's vaccinated.